wanna build a snowman or a system with AI? Sorry, I couldn't resist. The FDA just announced their new AI tool called 𝐂𝐴. And okay, I'm excited, but not all the news coverage shares my excitement. To me, this could be game-changing and should really wake up the industry to the importance of this topic. But not just because of what they're promising, but what they're not saying about what this means for all of us in life sciences. I've been in quality for over 15 years now, and I've never seen the FDA move this fast on anything. Okay, let's recap. The FDA announces completion of first AI-assisted scientific review pilot and an aggressive agency-wide AI rollout timeline. Now, this is the original press release from 8th of May 2025, where the FDA commissioner goes and says, we had a historic first for the agency. We want to announce a very aggressive timeline to use artificial intelligence internally across all FDA centers. And we want to do this by June 30th, 2025. So they set themselves a about 2-month timeline to roll this out. They ran a pilot and they were blown away by the success of this first AI-assisted scientific review pilot. They go and explain how they can reduce the amount of non-productive busy work, that this technology has been a game changer. Overall, they want to roll this out by the end of this month. But then, a few days ago, this happened.
Today, the FDA has launched a new AI tool agency-wide called 𝐂𝐴 to modernize how the agency functions. Following a very successful pilot program with our scientific reviewers, we announced a goal date of June 30th to implement the AI tool agency-wide. Today, we met that goal ahead of schedule and under budget, thanks to the willingness and collaboration of our in-house scientific leaders across the centers.
We're talking about an agency-wide AI deployment that they're calling ahead of schedule. But first, because I'm not going to be able to focus until I research this, what does 𝐂𝐴 stand for?
One eternity later.
Nothing. Is it someone named 𝐂𝐴? Does it stand for effortlessly letting stuff accumulate? Or enchanted lady with spectacular abilities? Or my personal favorite, everyone, let's start again. Yeah, I'm not particularly proud of the time I spent going down this rabbit hole. But I did develop a theory, so let me share it with you. The FDA hasn't officially defined it, but I'm thinking it stands for electronic submission analysis. Because what they're really doing is letting go of the manual document review. Okay, back to 𝐂𝐴. When has the FDA ever been ahead of schedule on major technological rollout? This isn't just fast. This is unprecedented speed for a federal agency. You know what this sounds like to me? It sounds like they're feeling the freeze. The competitive pressure from other global regulators, the EMA, Health Canada, agencies in Asia, everyone is racing to implement AI-enhanced regulatory processes. There is also an additional worrying trend that FDA drug investigator vacancies increased from 9% in November 21 to 16% in June 24, and the trend has not been really helped by the recent changes in the agency. So the FDA cannot afford to be left out in the cold when it comes to regulatory innovation.
The agency is using 𝐂𝐴 to expedite clinical protocol reviews and reduce the overall time to complete scientific reviews. One scientific reviewer told me what took him 2 to 3 days now takes 6 minutes.
2 to 3 days now takes just 6 minutes? That is a 720 times reduction. That is like changing from horse-drawn carriages to bullet trains. It's like being frozen in place to let it go at light speed. Let me put this in perspective. You know how we built our entire quality system around the assumption that regulatory reviews take months? That we have weeks to prepare responses to their questions? That world just ended. Here is the thing that everyone's missing. If they can review your submissions in 6 minutes instead of 3 days, what happens to your response expectations? Are your quality systems even capable of operating at AI speed? As someone who navigated countless regulatory interactions, the entire rhythm of regulatory dialogue was driven by the speed that regulators can ingest and digest information. And that rhythm just got compressed by more than 99%.
We're also using AI to help inspectors identify high-yield inspection targets.
Okay, let me stop onto my soapbox for a moment. High-yield inspection targets? That's regulatory speak for we're using AI to predict which facilities are most likely to have problems. Think about all the data they have on your facility. Every submission you've made, every historical inspection result, your adverse event reportings, manufacturing change notifications, even how long you take to respond to their questions. Now, imagine an AI system that analyzes all of that and says, hey, this facility has a 73% probability of having compliance issues. Let's inspect them next. This isn't random inspection scheduling anymore. It's algorithmic risk assessment. And here's what's keeping me up at night. They didn't define what high yield means. Are they optimizing for finding the most violations per inspection hour? We don't know. Now, don't get me wrong, I'm all for risk-based inspection management, focusing resources on where the agency can have the biggest impact on patient safety. But when you don't know the algorithm's criteria, how do we know that that is what it does? And referencing a previous edition of Fabrizio's Steps on a Soapbox, it's not influenced by policy.
One question I'm frequently asked is about the security of the tool. So I want to be clear. All information stays within the agency, and the AI models are not being trained on data submitted by the industry.
Wait a second. This seems like classic misdirection. They're telling us what AI is not doing, but they're very quiet about what it is doing. Yes, your sensitive data isn't training their models. But here's what they can do. Analyze patterns across all your submissions without using your specific data for training. Compare your submission against every other submission that they have received. And use AI to detect statistical abnormalities in your clinical data that human reviewers might miss. It's like they're building their own frozen kingdom of interconnected data where nothing's hidden anymore. The real question isn't whether they're training on your data. It's whether you are analyzing your own data with the same sophistication that they are now analyzing it with. I remember, and probably some of you do too, when we first started using statistical process controls in manufacturing. The companies that embraced it early had a massive advantage. This feels like that moment all over again, with just one difference. It seems like the regulatory agencies are going first. So, what do we actually do with this information? Because that's what matters, right? First, audit your submission preparation process. If reviews that took 3 days now take minutes, how long does it take you to compile a response to FDA questions? That timeline just got compressed dramatically. Second, think about your data analytics. The FDA is using a secure, unified platform with document integration and outputs tailored to center-specific needs. Are you using similar analytics to ensure that your submissions are optimized for an AI review? And third, prepare for what I'm calling the summer blowout approach to inspections. If AI can identify high-yield targets, your facility might get flagged not because of a routine schedule, but because an algorithm detected something in your submission patterns. Look, this isn't necessarily scary. Better preparation, more consistent data, proactive quality management, these are all things we should be doing anyways. But the AI revolution means we can't afford to do them slowly anymore. The cold never bothered them anyways, right? Well, it shouldn't bother us either if we're prepared. Here is, however, what I find genuinely exciting about this. For the first time in forever, we're seeing a regulatory agency that is not just talking about innovation, but actually implementing it at scale. They've appointed Jeremy Walsh as Chief AI Officer, someone who previously led enterprise-scale technology deployments across federal health and intelligence agencies. This is not a pilot project anymore, it's an operational reality. So the question for all of us is, are we ready to match their pace of innovation? Because the regulatory AI revolution isn't coming. It's here, it's deployed, and it's processing submissions right now. What does your organization need to prepare in this new reality? Look, the regulatory landscape just transformed faster than Elsa's ice palace. And honestly, I think that's exactly what patients need. Let me know in the comments, are you ready for AI speed regulation? Or are you like Anna stumbling through the snow? Thank you for exploring this frozen, evolving landscape with me. Remember, we are all just trying to get better medicines to the people who need them. And sometimes that means letting go of the old ways and building something new. Until next time, keep questioning, keep learning, and maybe keep a few frozen references at hand for your next regulatory meeting. See you in the next one.